Cynthia, are you ready? We love your background, by the way.
Okay, thanks.
Okay, members, I'm going to be chairing today because Cynthia's with us virtually in outer space somewhere, or maybe in the north. I'm not sure.
I wish.
Yeah, okay. All right, let's see. Good afternoon. Today is December 10th, and it is 1:13. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Strategic Planning Committee. As a reminder, a committee member may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. I'd like to announce that in order to make it more accessible to community members, we will hold public communication for the Ad Hoc Appointments Committee, Strategic Planning Committee, and the Board of Managers meeting right now. Do we have any public comment? None? Okay. All right. We're now going to proceed to the committee agenda. The first item is review and approve the minutes of the November 12th Strategic Planning Committee meeting. Do I have a motion from Manager Jones or Manager May? Okay, Manager May moves, Manager Jones seconds. All in favor, and this is the committee. All in favor? Okay, it passes. Now we go to the second item. Receive and discuss a debrief on board manager's tour of University Health Medical Center in San Antonio. So, and members, we allocated about 15 minutes or so for this conversation, and the purpose here is for those folks who had the opportunity to go on the tour to share their thinking about that, and then of course if there's any questions and conversation we could do that. We just allocated about 15 minutes because we have a lot of other things to get to. So, would anyone like to go first? Dr. Martin, would you like to go first? Because you had, yeah.
Microphone. So I'd like to thank Dr. Lee for setting it up. It was a great experience. The takeaways that I had was first and foremost create a culture of trust with our partners, in particular the people who control our budget, the county commissioners, to really establish that relationship really in depth and a friendship and a mutual understanding of our shared mission. The second thing I got was to each entity in the healthcare system should be made the best possible. We mentioned their health insurance company and how they strove to expand it on purpose to capture as many patients as possible in the surrounding counties within the context that they could serve those people. But I think their focus was specifically, yes, we have to take care of our patients, but we need to make this the most profitable adventure we can to help fund kind of Robin Hood their patients. One thing I heard repeatedly from the board was hire great staff, oversight, and get out of their way, and let them handle it. Do not micromanage the issues. As we saw, their meetings are very short. Not to say anything about his, but it's this thing that really truly their trust in the people they've hired, the oversight they offer, and the guidance, but they let the management issues be run by them. What else? Another segue was their pharmacy, for example, much like the health insurance, that sort of make it the most profitable center they can to help fund their mission as well. And I think that, as we already have here, but I think it's important to convey to the medical school and to the commissioners that we have a culture of a shared mission. That yes, they have to educate the residents, we have to take care of the poor, the county has to keep the budget, but we're all on this shared mission. And that was a recurring theme that they had of, the medical school would send faculty to their board meetings. And they were on a phone conversations with the commissioners as needed. So that was kind of my main takeaways related to that. But I asked them repeatedly about how do they manage it, and we hire great people, and we kind of stand back once we give them the mission we wish to have accomplished. So that's it for me.
Mm-hmm. Lisa, do you want to say anything? You and I were the only, did you go? Oh, I'm sorry, I forgot.
I did, yeah.
Go ahead.
I think two things that I really appreciated was, one, their systems level approach or viewpoint, that they needed all of it and the complexity around it. I think the one question I didn't ask was how their matrix reporting kind of works out, because that's, you end up having to do that in complex organizations. And then the second takeaway was the financial sustainability, the fact that the board, I think it was, and correct me if I'm wrong, they said the tax rate was about 15% of their budget. And which they have a higher tax rate than we do, but they obviously have a larger investment infrastructure in the health system itself. But I thought that was really interesting how they have really focused, like as you mentioned, around like the profit centers and how they all kind of work together as a system.
Okay.
My takeaways were, I was very impressed with the use of technology. Their use of security was highly impressive and pretty sophisticated in that they, oh, I'm sorry. I don't have to repeat everything, do I? Okay. Their security with the name badges for the staff, those themselves act as a security button for them at the same time. And so that to me was impressive because they don't have to tell somebody, go call the police or go call. They just need to just hit that badge and that alerts security to come to them. So that really impressed me. Impressed me also, obviously, not just from the more immediate staff piece, but also too in terms of how they access the building, how other individuals can access the building, again, using a lot of their technology. Using technology in the actual hospital room to the level that they're using it. Honestly, I was very impressed by that because I don't see San Antonio as being necessarily all that advanced, so to speak, but obviously I was wrong.
I think where they had the weapon sensors and the barriers.
Yes.
And it didn't sound alert, but the camera would track that person, and then security could then kind of, I mean, that's important in major trauma hospitals. I mean, we've had shootings at Brackenridge before and stuff like that. I think it's a very important key. But I'd like to segue, not to, so I just want to
Wait,
say one thing. Yeah, go ahead.
Let her finish, and then I'd like to say something.
One more thing.
No,
And,
please.
well, two more things. The other thing that I was impressed by, or not impressed, but it stood out for me was, it's obvious that they have a very robust philanthropy program. And that impressed me too, right? And of course, they've been around for a while, much longer than we have. They're further along in the whole system transformation. But that being said, they're doing very well with money. And again, I don't see San Antonio necessarily being a well-to-do community. I've never have thought them that way, but they're doing well in that area. So that was the other thing that impressed me. And then the other thing that I was really impressed by was the architecture of how they've done and created the building space, the patient space. You know, they have these, as we all saw, they have these outdoor patios up on, what was it, third level, fourth level? I don't know what level we were on, but it was higher up. And it just made you, it created like you're outside in your backyard, in a backyard, I should say. So I was very impressed by that. I definitely could see how they could be a model for us. Now I know why the staff wanted to take us there. They can be a model for us in some particular areas. That's all I've got to say.
Yeah, and I
Okay,
just-
wait, I haven't
No,
had
I'm
the
sorry,
chance to speak.
I'm sorry.
I went also.
Yeah, I know.
So, my takeaways were, I'm probably gonna be repeating a few things that you all said. And I'll just start from the last perspective. Yes, the architecture was very interesting. You know, because it was sort of that, I think we all kind of talked about that a little bit. The space that you're in contributes to health, contributes to recovery. And so I think paying attention to that is really important, and they do have a beautiful setting. Second thing is a culture of trust. Now, what was interesting to me also is that we didn't go into detail with them, but they did talk about the fact that they had to build that. And there was some reference to, you know, difficulties in, you know, years past that they moved past. So that was, it was sort of, I got the sense that they had gone through a transformation process. Again, we didn't talk to them about exactly what that was, but, so what we were hearing is the result of that process and seeing the value of the result of that process as to where they had gotten. So, the other thing that they said was, I think I agree with everything all of you guys said. It also struck me how they talked about making, I think you put it as making each of our partners the best that they could be. Because we did specifically ask them about a question that came up related to Sendero and our retreat with the Sendero board. You know, that question of what's the scope of Sendero's services and stuff. And they were real clear that, well, at least with regard to their health plan, they viewed it as, they didn't view it in a limiting way. In other words, they viewed it as that health plan needed to be the best that they could be. So I thought that that was instructive for us. Of course, they did mention don't micromanage, which I think we've all acknowledged that we're on a path to getting to that spot. And, you know, the conversations we've had about policies versus SOPs and that kind of stuff, we're on a path. And then the last thing I would say, yeah, I agree. I did hear them talk about the medical school and that shared mission with the medical school. So those were my takeaways. Any questions from you guys, Shannon or Cynthia? You guys weren't there, or does anybody have any questions or more they want to talk about?
You had something else to say?
Yeah, I was just checking with people who haven't talked yet. So Shannon or Cynthia, do y'all have anything before I turn?
Yeah, I have a couple questions.
Okay. Go ahead.
Well, very good. I'm glad. Unfortunately, I wasn't able to make it. I would have loved to make it. And it sounds like they have a very advanced initiative that's been added. When was their district founded?
I don't know. That's a good question. Does anybody know?
But the change,
Like 58?
they said the changes though that they invoked were about 25 years,
25
22 years ago. They started this,
25?
about 25 years ago.
About 25 years ago, Shannon, they started their sort of transformation.
I remember
Well,
that.
you're saying 55,
Right, but
Nope.
they,
but
Go ahead.
something
yeah,
happened.
but they had this dramatic change in their approach to county health about 20, 25 years ago.
Oh, okay.
Yeah.
Where it was like a Parkland disaster, and they got the community to come on board.
Okay.
And that's the magic trick.
Which leads me sort of to just a couple of questions. One is, did you all have the opportunity to go outside of the hub of the of the hospital, of the medical school, to get a feel for the clinics in the community?
No,
We just toured the
Just the
hospital.
hospital?
we just toured the hospital.
Okay.
We didn't have time.
Did you have the opportunity to talk to anybody from the community in
No.
terms of this? Okay. And then we all talked, I assume not, but I'm just asking, did you all talk anything about their approach to addressing disparities in?
I don't think so. Did y'all hear anything? We didn't get into that level of
Okay.
detail.
So primarily it was a facility type of
Yeah,
Well,
tour.
it was a system.
Systems,
tour, yeah.
systems,
Really
yeah.
to understand their systems,
Yeah.
I think, more than to tour the hospital.
Okay, but, so systems, I assume, also operate outside of those venues too as well. So-
yeah.
Well, they're building, he mentioned they're building 2 community hospitals in service needs areas, 2 big community hospitals that they've already contracted to buy or build. They just had bought another hospital. And so it was addressing, they particularly noted they're putting hospitals where the community needs them.
Well, that's the question I was
Yes,
trying to get at.
that was addressed,
Okay.
and, because they were very enthusiastic about it, so.
Okay, then. All right then. Oh,
The other thing is, there was there was definitely an interest in follow-up and additional conversation with them, so.
okay, yeah, there was one other thing. Thanks very much.
Okay.
The philanthropic approach. Did they allude to some of the philanthropic businesses or industries that are helped support them that may be in Central Texas specific or nationwide or international? They talk a little bit about who they were and.
Let me ask Elisa that, she might know.
Here's what really got my attention. The chairman of their board is a businessman, and he owns restaurants. and he's been in that role for a while. So I really like the fact that they have a strong business person on their board, because obviously, business, we're not, we're not there yet, but that's on the plate for our philanthropic discussion. We've gotta get business involved in our work, right? And in order to do that, of course, I'm hoping that we're gonna do it through the creation of our foundation as we move forward. But that being said, I don't wanna get out of, too far ahead, but that really got my attention. And I like the fact that they have a businessman, a respectable businessman at the board of directors level. I really like that. He was the chairman and had been for a while. I think that's really important.
And one thing also, he specifically said, we're not allowed to give away money. He said, we have a philanthropic arm. As ourselves, we do not give money away. He said that's why they specifically set this up, to not sort of be the deliverers of the funds, but to sort of direct people to philanthropy and whatnot, to build that philanthropic fund that we need as well, so.
And it sounded that they already had a very.
Wait, guys, let's, you want us to go next? Go ahead.
Well, to follow his point. It also sounded that, because I think one of us asked the question about how they disperse their money out to communities, like community grants and so forth, similar to what we sort of do, that we're just now beginning to establish a policy for how we decide or how we'll consider what community groups are gonna get some of our funding as a result of their needs that are not getting covered in other places. They already have that process down. It sounded like they already have that and they follow that process, which again, for us, that's a good thing for us to learn more about.
Okay, and last question was, what restaurants did you go to on Riverwalk?
You didn't miss out on anything.
We missed that
You should have
part.
seen the traffic.
Let me see if Cynthia, Dr. Brinson, do you have any questions or comments you'd like to make? What, we couldn't hear you? No? Okay.
I
Okay.
have a couple comments, just
Okay.
real quick. One was, and as a former ER physician, I was stunned by their emergency room, right? I mean, 200,000 patients a day, 3 helicopter bays, 20 ambulance bays. That emergency room, waiting room, was for the most part empty. And the reason why is their nursing ratio. And that was a model. If you go to Setondale, St. David's, help us, South Austin, the worst, you have 40 to 50 ER overflow patients in the ER at any given time. And it's not because there's not beds, there's not nurses. The nurses have about a 1 to 10 to 1 to 15 ratio. In San Antonio, it's 1 to 4. So the last thing a nurse on the floor was going to do is, oh, let's clean the room and get another patient with all the paperwork and assessment. So the rooms just sit empty. And I was really impressed by that. And also how they empower the nurses. The nurses are just as smart, if not smarter than doctors. And they're empowered to handle infection control, assess data. I mean, it was really a very empowering. I mean, he shook hands with everyone on the floor, Jim did. I mean, the guy knew everyone. I just was very impressed by that. And one thing, you know, this I had dinner with Bridget Shea, and she was blown away. And Cynthia Brents was there when I said, you know,
You're in public.
oh, I'm sorry. Well, it was a social conversation.
Yeah, but you don't want to repeat what somebody else.
No, it was just the fact that the budget of the relative what Geronimo said, it's 15%, was very impressive. It impressed them that their financial situation is so cohesive that way, of creating these resource centers to fund the whole system. So it was very impressive. So
Ooh, I hear a snorker.
What?
That's not wrong.
Okay. On that note,
Just.
Anything else? Go ahead, Shannon.
Just one question, not really. Do you all plan to do a similar thing with Harris Health?
we can. We don't have any plans yet, but we certainly can.
I won't be here, but I would encourage you to.
Okay.
Look, San Antonio, Bexar County, and Harris County are significantly different cities
Yeah.
with different populations and different challenges. So I would encourage you to see their approach. I'm not saying one is better than the other.
Yeah.
I'm just saying it would give you insight in terms of options for here as well.
Yeah, I think it's, we have major hospitals in, Dallas, Houston, San Antonio, Galveston. The more we know, and see other hospital districts, I think the better we are. So, so and we have our own, we're unique in Austin, of course, but we can learn from the best of all the other places. So, okay.
The
All right.
Cowboys are in Dallas, so you don't need to go there.
Okay. Are you guys ready to move on, or? Are you guys ready to move on? Okay. All right. The next item is discuss and take appropriate action on process and parameters for development of Central Health Strategic Plan, including review of system transformation policy and strategic framework. So, members, we've allocated as much as an hour for this. I would caution everybody that we started about 20 minutes late. We'll take the time that we need, but just to give you all the understanding of the parameters that we're at. So I think we have, Monica, are you presenting then? Yeah? Okay. Okay. And go right ahead.
So, thank you, Chair, thank you, members. Members, in your backup, you have the documents we're referring to, that's in your packet. Today, we're revisiting discussion from our last strategic planning committee about Central Health strategic direction and the path ahead. As you recall, the system transformation policy before you sets a proposed direction for Central Health to build a coordinated system of care that delivers timely, affordable, and high-quality services to all our residents. This policy outlines the foundation for our revised strategic plan, which is focused on fulfilling our dual commitment, expanding access to high-quality, whole-person care for those needs most, while ensuring long-term value and responsible stewardship of taxpayer dollars. In practical terms, this policy lays the essential groundwork for us to achieve two bold outcomes by 2035. You recall these from our postcard from the Board of Management 2035. Namely, a 50% reduction in health disparities in our community and a simultaneous 5-to-1 or better return on taxpayer investment. Oh, I'm so sorry. Okay. Shall I go on? Okay. To briefly recap, there are 5 key components outlined in these documents that will inform our strategy. Component 1 is a connected continuum of care. Our guiding goal is to build a connected system, including primary preventive care, specialty care, hospital care, behavioral health care, and recovery care, so that patients move through care seamlessly rather than through a series of disconnected programs. Component 2 is high-quality, whole-person, community-based care. Comprehensive care addresses a patient's physical, mental, and social needs together, and delivering that care in a respectful and consistent manner that meets people where they are is essential to earning trust and improving our county's long-term health. Component 3 are board-approved equity, quality, and access benchmarks. So we will intentionally design for equity, closing long-standing gaps in outcomes and access, especially across the I-35 divide and other demographic gaps in our community, with clear, measurable benchmarks that will be set and approved by the board. Component 4 is strong fiscal stewardship. To implement this plan responsibly, we will have to maintain strong reserves, use debt wisely, and leverage the full range of federal, state, and private dollars that may be available so that we can reduce the burden on our Travis County taxpayers, very much like the discussion we were just having about University Health in San Antonio. And component 5 is collaboration and partnership. Undertaking major transformation like this requires partnership. We will engage patients, communities, and our partners in a strategic way to advance our work effectively and efficiently. Per your direction provided in the last SPC meeting, we have added additional language to the policy that details the roles and responsibilities of the board in directing this system transformation, including by approving our updated strategic plan that will help guide the path forward. There's a sense of urgency here. If we enact a revised strategic plan that reflects this policy, we're already well on our way of building out a coordinated system of care that reflects our mission, honors the public's investment, and improves people's lives across our community, we can build upon the healthcare equity plan that this board has set forth and complete that circle through hospital and recovery care, mental health care, and so on. And so with that, I would like to pass things over to our Chief Strategy Officer, Monica Crowley, to briefly recap some of the policy details and the language around the board responsibilities that we've added. Then we'll open the floor for discussion and set the stage for appropriate action so we can get to work on revising that plan with your guidance. So Monica, over to you.
Thank you, Pat, and thank you, board managers, for having this discussion with us today. Just what's to come is we'll have 3 slides that go into a little bit more detail on this draft system transformation policy, and then a final slide that looks into the key elements of a strategic planning process. And we're really interested today in gathering your feedback on the draft system transformation policy and the process related to strategic planning, and we're excited about continuing this important work together. But starting off, a little bit more information on the draft system transformation policy. Really, as Pat had said in his introductory remarks, this policy, under the ongoing stewardship of the Central Health Board of Managers, commits Central Health to transforming a fragmented healthcare safety net into one comprehensive, connected, trusted, and accountable system of care. And then Pat mentioned in his introductory remarks how this is designed to provide the foundation for Central Health to fulfill its mission of serving those who need it most and delivering exceptional long-term value to the Travis County taxpayers. Next slide, please. Pat went through the 5 pillars of this draft system and transformation policy. A little bit more information on one of the key elements of the system transformation policy, the coordinated continuum of care. This draft policy directs that the Central Health System will develop, together with key partners, so not going it alone, but continuing to work with key partners, a full connected continuum of care. And under this continuum, as Pat had described, every component will work together so that patients can experience a seamless journey across the healthcare system. And the board will play an essential role in establishing this connected continuum by defining what success looks like across the continuum and ensuring clear accountability for results in the development of the continuum. The high-quality, ambulatory-driven, whole-person care pillar provides this focus on care happening as much as it can in community settings, and really focusing on this whole-person care that addresses physical, mental, and social health together at once, so that the people we serve can stay healthy and stable, or get and stay healthy and stable, and not just receive treatment when they're sick. The board's continued guidance will ensure that the system's design and investments reflect these principles of whole person care and remain aligned with Central Health's mission and public obligations, ensuring that all residents, regardless of income or zip code, can receive timely access to high-quality care. Next slide, please. Another pillar of the draft system transformation policy that we'd like to draw your focus to is the pillar of board-approved benchmarks for access, equity, and quality. The policy directs Central Health to design a system intentionally to build equity, closing gaps in access, closing gaps in experience, and closing gaps in outcomes across our communities to address the East-West health divide and other systemic inequities. This is essential to improving the overall health of Travis County and meeting the board's long-term goal that Dr. Lee mentioned in his opening remarks of reducing health disparities by half within the next 10 years. And the board will perform or will play an important role in defining and approving the targets and benchmarks that Central Health will use to measure our progress related to improving access, equity, and quality. Central Health will also have a pillar around fiscal stewardship and long-term sustainability, and will use its financial authority and capacity strategically. And this policy directs us to own essential infrastructure, maintain prudent levels of reserves that will be set by the board, and leveraging federal and state funds, attracting additional private investment, and using our debt wisely. The Board of Managers will continue to define and oversee the final process governing all of these areas, ensuring that our public funds are used transparently, effectively, and within clearly defined limitations to protect long-term sustainability of the system. The final of the fifth pillars is this pillar around collaboration and partnership that this policy directs Central Health to continue to focus on. The policy directs Central Health to engage patients, communities, and key institutional partners, including but not limited to Integral Care, the University of Texas at Austin, the City of Austin, Travis County, and other healthcare and social service organizations to co-design and implement the system. Partnerships will be structured with shared goals, clear roles, and aligned incentives to achieve board-defined outcomes. Next slide, please. Dr. Lee had mentioned that after the presentation last time that the board had directed him to provide more information about key board responsibilities and decisions related to implementation of the system transformation policy. And there will be governance responsibilities regarding strategic direction, fiscal authorization, and performance oversight. And there are board roles in, as were described, in every one of the 5 key pillars of the system transformation policy. And this work includes the work mentioned before with the 5 pillars, as well as approving essential system components, the scope and standards of the comprehensive system of care, approving the master facilities plan, including an updated downtown or Brackenridge campus area master plan, and reviewing, amending, and adopting an updated Central Health strategic plan that also incorporates an updated 2026 community health needs assessment, the assessment that we're jointly conducting with Community Care. Next slide, please. So here are some key elements of a strategic planning process, and we had discussed these briefly in advance with Chair Kitchen during the pre-meet for this meetings, and they include a proposed timeline for the strategic planning process. So you guys can direct us on this timeline. That typically is a 12-month process to complete a new strategic plan. Includes engaging consultants as needed, updating and building upon the ongoing healthcare equity plan. We need advice from and determination and direction from the committee and the board on the appropriate time frame that the strategic plan will cover. And I believe you have had discussion about this in the past. Sometimes, sometimes people do 3-year strategic plans. Sometimes they do up to 10-year strategic plans. Since I've been at Central Health, we've had a 3-year strategic plan. We've had 1 2-year strategic plan, and then we had a 7-year strategic plan, which is the healthcare equity plan. And then we will complete the joint community health needs assessment with Community Care and a gap and capacity analysis that will feed into an updated strategic planning process.
Okay, did you want to say anything else before we start? Okay, I'm going to open with just a threshold question, and then we'll have everybody talk. And it really is, it's semantics in some ways, but in other ways it has to do, it's a process question. So, to me, what's before us, the document that's before us, it doesn't, in my mind, in the way that we've been talking about what a policy is in our about bylaws and policy committee meeting, to me it doesn't fit as a policy. Because let me just explain. To me, a policy is the order is okay. You got your plan, your strategic plan, and then you have a range of policies that you adopt that are about implementing the plan. And the policies are governance level, not operational level. And then the CEO and his team and his staff put in place their SOPs, which are how they're going to operationalize the policies. But to me, what we're talking about is a policy before we have a plan. So that doesn't mean that there's not value here. I'm not saying I don't agree. I'm not saying I don't agree with this kind of direction. I'm just saying, depending on what the board and the committee wants to do, I would call it something else. I would call it as guidance, direction, strategy that's going to guide the strategic plan. So in other words, the kind of components, those 5 components that you went through, and the language about the big picture vision, just for me, I would say, okay, go develop a strategic plan, incorporate in that strategic plan these vision items, and then, you'll bring it back to us and we'll have all the conversation about it. And then after that, we will develop various policies, because there's a range of policies that are governance level policies. You've mentioned the fiscal ones, that's mentioned the facilities master plan, but there's some other ones too that we've talked about. Like we talked about a ambulatory access and quality plan. We talked about that last year. We've also talked about a central health integral care behavioral health system of care plan. So there's various other plans, but the big one to my mind is the strategic plan, and that's kind of the North Star that guides everything, and everything we're doing for the next however number of years we want to set it for. To me, that's the North Star, and we're building our policies off of that, and then our CEO and staff build their operations off of the policies in the plan. So can we talk about that for a minute first, and then we can get into the content? Am I off base on that? I'm looking at Geronimo because we've been part of these bylaw and policy conversations.
Well, a couple of thoughts come to mind. I think one of them is, if we don't call it a policy, then what should we call it? Because I think one of the threshold, as you mentioned,
Yeah.
these threshold questions, whether it's policy or not. The other threshold question is this the will of the board? Is this
Yeah.
the direction we want, to
Yeah.
make sure that we're being very clear when we say to the administration, hey, we're gonna exercise oversight, here's what
Yeah.
we're expecting.
Yeah,
And this also gives the administration the ability to move and transform, because I think in transformation, there's so much failing fast, learning fast, moving, adapting. At least get the input from all of our board of managers. Are we all in support of this, to make sure that there's clear direction to it?
yeah, I would call it, the difference to me is a policy, once we adopt it, it is set in stone. I mean, you can always change it, but the idea is it's an ongoing thing, and it relates back to what the board has adopted as the vision. So given that it'll take us a year to do the strategic plan, we want to provide guidance in the meantime. So I would probably call it direction or guidance. From a practical standpoint, the key difference for me is it's not an ongoing policy. It's sort of an interim thing that directs how the strategic plan is developed. And then it's almost incorporated in the strategic plan when it comes back to us. I guess that's what I'm thinking.
Yeah, and the other question might be to ask board council, like what word could we use here to make
Yeah.
sure that it's binding or
Yeah,
it's got a full force and it's not just like a sense of the board or an
Yeah.
advisory, but it's like this has the power of the will of the board, the majority of the board behind it.
okay.
If that, I don't know if that's a appropriate question to ask of.
Do you
board
want to
council.
ask them now, or should we come, they want to think about
Depends
it?
on
Or
whether, yeah, if they wanna think about it.
David, Hasib, did you want to?
I mean, we can say a board vote. Manager Rodriguez, a full board vote would be the best way to do that. But I'm sure if Julie or David have anything else to add.
Oh, you don't have a mic. Shoot.
Thank you. As Hasib stated, it is up to the board. It is the board's will. What you call it, how you use it, how you move forward, that's all on you.
Okay.
So how you want to move forward with that, you decide. Policy makes sense. If you want to call it something else, but whatever is going to work for you to get the business done that you need to get done.
Okay, did that answer your question?
Yeah, I did, yeah.
It answers mine too. I just, I don't want to create semantics. The main difference is that I see it as directing the work of the strategic plan process and then incorporate it in the strategic plan that comes back to the board. In other words, I don't see it living as a policy that's separate and apart from the strategic plan. I guess that's what I'm saying. So, but anyway, so that's just one point I wanted to raise that is more of a procedural point. Why don't we turn now, and I'll just go around the room and see what y'all's reaction is to the what's in front of us. Would you like to start, or do you want me to? Okay.
I think as I've been serving on this board, my sense is that we are in some tremendous transformational change and a very competitive environment. And so it makes sense to have policy, guidance, guardrails, whatever the appropriate word is, to ensure that we are aligned with the administration and how they're moving forward. Because I expect there'll be things that they are gonna have to do quickly and adapt. And while we will always get informed about it and have the ability to oversight and approve things, I think there's probably an opportunity for us to be aligned with the administration around what direction we're taking it. And I think this creates sort of those concepts that are needed to ensure that there's alignment, and then also where there's a healthy tension to come back and just say, this is where we're going, and explaining why these things are happening or why they're not, and kind of continuing to move forward. Because if you're transforming into a system from a lot of different silos, and I always say that there's a lot of silos of excellence that need to be integrated or transformed towards the end result, which is being patient-centered and the quality of the care, the outcomes. I hope this is helpful to the administration to kind of like, this is where we all are in support of going forward. Because I'm sure there's gonna be places where we're not gonna be, and we need to have a conversation and stop there and do those things. But this is at least a proactive effort, direction, intention of the will of the board.
Okay. Do you have any thoughts on the language?
No.
That's okay if you don't. I just was asking.
No, I think at some point, to your point about the strategic plan, we have the health equity plan, we have the strategic plan.
Cool.
I think in the future, there's an opportunity to try to create one consolidated strategic plan.
Okay. Okay. I'm going to let her catch up. Do you have anything you want to say?
Yeah, I mean, to me, maybe I'm missing the point, but I believe these are kind of issues that have, to a large extent, been settled, and I think they should be brought, maybe perhaps to the board for a vote. If this is what, but to me, this does seem like policy. Directing them to do, I think if we all agree that this is kind of what we want, which I think we've already agreed upon to a large extent, I see no problem with it. I mean, I think he's certainly open for discussion each point, but to me, this seems like a policy, so.
Could we get another copy of this? I don't think it's in Maram's packet, so. Shannon, did you have anything else? Okay, Shannon, do you have anything?
A couple of things. One is, I'm understanding what your concerns are. That
Yeah.
makes sense. But I guess my question is
There,
that
you got it.
this, as I read it, is strategic system transformation policy and strategic planning elements. So these are elements of it, they're not the policy itself,
Yeah,
as I interpret that. So
okay,
I understand we need to be clearer in terms of what we want this to be, but I think what is being positioned here does that. The second question I raised goes under draft systems transformation policies. Can I ask that question now?
yeah,
Okay. It's just, well, we've listed all of the partnerships that will go into the collaboration. I didn't see, and maybe I missed it, community groups or organizations. I see the governmental bodies involved, but is there, in this section, is there a desire to have community groups, neighborhood associations, 501Cs that are not necessarily funded, but are representative of the various communities around the
Yes,
community?
certainly mentions. We can amend the language. When we said many healthcare and social service organizations across the community, that was our intent, but we can update that language under collaboration
Well,
and
let's,
partnership.
let's work off of what we're actually voting on.
Okay.
So, just so we'll know what the language is, are you talking about which item was it? Which number was it?
I believe it's number 5.
Number 5, okay.
And it says, including, Integral Care, UT, City of Austin, Travis County, and many healthcare and social service organizations across the community. That was the intent, Manager Jones, but if there's different language that would be more accurate, we're happy to incorporate that.
I would just add, because there are community groups that are not social service organizations.
Okay.
That are engaged in health in their communities and things. So I would add maybe community groups
Sure.
or community and or neighborhood groups.
Okay.
Can I just follow up that question real quick? You outlined, there's another page that outlines the process for developing the community plan, Monica, the strategic plan. Does that have a step that includes engaging the community? I think it was your last slide or something.
Apologize. It does not specifically say engaging the community, but absolutely that is something that absolutely is part of any strategic planning process.
But we need to say it because a
We
lot
need
of,
to add it.
a lot
Yes.
of community groups do not believe that they are involved and engaged in these efforts.
Manager Jones, in the first sentence of paragraph 2 on the first page, to achieve this objective, the
Which
CH,
one now? On this-
on the very first page of the policy, the first sentence of paragraph 2, to achieve this objective, the CO shall engage patients, communities, and clinical and academic partners. And so again, the intent in calling out communities was exactly that, but if there's more accurate language, it should be used.
Yeah, I think he's talking about something different, Dr. Lee, or actually, there's two of us we're talking about two different things. I was talking about the process of developing the strategic plan, which the language you have right here is not, that's not this. That's the language she put forward about how the strategic plan would be adopted. And then I think you're asking about something else, which might be what you're talking about, right?
Yeah, I'm asking just that we spell out and be inclusive
Okay.
in the discussion of collaboration and partnership,
Okay,
include community and neighborhood associations as opposed to just social service agencies, because they are not the same always.
Okay, that's a great edit.
And I think those are both great edits, actually, because I think the place that it's, and I agree 100%, and thank you for lifting up not having any of this be implicit is when we say we'll complete joint community health needs assessment with community care and gap analysis. Included in that is gathering the voice of the community, but I think including community engagement and seeking the voice of the community as part of that work, we need to have that be explicit in anything that you direct us to do. So thank you.
We have to be more explicit in the environment we live in today.
Okay, thank
Spell
you.
it out.
Anything
That's
else?
it, that's it.
Elisa, did you want to?
Couple of questions. Thank you. Couple of questions. Do we intend, while they maybe have a small role, but do you all intend to include Sendero in this process?
100%.
Okay,
Yes.
so
Yes.
it would seem to me that potentially a place that they fit in the actual document where you spell it out would be under your community health needs assessment. Because obviously that's an insurance thing, and there's gaps there. So I'd like to see that explicitly, like where you have community care, Sendero, and gap analysis, if you would please. If everybody agrees with that, I think we should include them. The other question is maybe one of process. So you're gonna work through this, do you intend to bring the full board into the process of actually helping you develop the strategic plan, where we will actually be involved in it?
Yes.
Tell us how.
Absolutely. Part of, there typically, when we do this, you would be involved in first, providing the information to us today, so helping us set the timeline for the strategic planning process, helping us set the timeline that you would like us to focus on as we're developing a scope of work for us to engage consulting expertise and help. And then historically, we've worked with the strategic planning committee you have typically when you're going through a strategic planning year or so process, you have more strategic planning committee meetings than you might during the years that you're not going through an active strategic planning process. And so you have meetings with the consultants and the strategic planning committee, gathering information, setting, like you said, setting pillars, setting guideposts, moving forward, receiving initial looks around the needs assessment and the gap analysis, helping us gather names of community groups and organizations and individuals that we're going to include in the voice of the community and the needs assessment, receiving initial information, and then usually there are updates at the board meetings as well, and periodically we'll set a timeline at the beginning of the process working with the consultants and bring it back to the board and the committee for here's kind of the timeline for the process. Here's when we're proposing bringing back information to the full board, and we gather that feedback from y'all.
I'm gonna get a little
Yeah.
deeper in that. First of all, thank you very much for that. That helps me in terms of just kind of seeing how you're planning to do this. I'm talking more about bringing the full board together to work, once you lay out you know, all the variables that you need to lay out, i.e. the information, where the gaps are, et cetera, you've done your community profile or your community assessment, you know, you've done all that. At some point, what point do you bring, and maybe the plan is not to do that, which is okay. I'm just trying to understand where we as a board will actually come in and participate in the development of the strategic plan, not the process, but the plan itself.
Oh,
That's what I'm looking
I'm
for.
sorry. What I would say is, in addition to, so from the beginning, the committee and the board will be part of developing the process.
Yeah.
And then we will have probably at least monthly strategic planning committee meetings. I, would hope that the strategic planning chair would be working hand in hand with me and other members of the team on developing additional meetings for the Strategic Planning Committee, where the Strategic Planning Committee will review, it's not part of the process, the Strategic Planning Committee will receive information, they'll receive data, they will provide direction on who will be reaching out to from the very beginning.
I don't think I'm being clear.
I'm sorry,
One
I
more
see
step.
this as
Well, I'm
being-
just gonna say it one more time, and then, because I don't wanna
Yeah,
belabor
it's
the point.
okay. Yeah.
What I'm meaning is, if you do strategic planning, committee, which is great, but that's just a committee of 4. And not everybody can always make those meetings, right? So, and I think that well, first of all, I believe that a strategic plan needs to be developed by the input of your entire board. And so what I'm talking about more is an actual activity where you bring your full board to actually, once you gather all of their data, and you've kind of set your pillars, you kind of have an idea where it's going, your outline, et cetera, but bring in your full body, your full board, to then weigh into the different components. That's what I'm
Jimmy,
talking
I
about.
think I'm hearing you accurately, and please correct me if I'm not. I'm hearing the notion of perhaps, let's say, a retreat, a half-day retreat
some
at
sorts,
various
yeah.
points. Maybe there's a critical policy before the board that we now have some initial intelligence around, and now we're going to work through implications and really talk about what this policy now needs to accomplish as we specify the strategy to close gaps in equity, or we specify what needs to be accomplished in this part of the master facilities planning to meet those goals. Those kinds of key points where we get the sense of the full board that then provides further direction for smaller groups to then flesh that out. Am I hearing?
I'm hearing a disconnect, but
Yeah.
yeah, do you want to speak to it or shall I?
Give it a shot, because obviously
Okay.
I haven't made my point clear.
Yeah,
Enough.
here's the disconnect I'm hearing. I mean, what you're saying is good, and that needs to happen, and what you're saying is good too, but I think I'm hearing a question about, and you tell me if I got this right, the actual written strategic plan, okay, which is what we follow. What is the process for the board to weigh in on what it says?
Yeah.
Did I get that right?
That's exactly right.
In other words,
The
the
goals.
language in it, the components in it, what it actually says.
Yeah, your goals, your inputs, all of that.
Your steps,
yeah.
your all of that.
And I'm sorry, and I was not describing this clearly enough, and we didn't have a lot, so I missed the last strategic planning
That's
committee
okay.
meeting, I
too.
apologize. And didn't so we will bring back a proposal that we'll get your feedback on that lays out when we will bring back information to the board. So that, and then you'll give feedback on, so we can bring updates, and we've done it both ways. So I've participated in 3 strategic planning exercises at Central Health, and there are a lot of different ways we can do it. We can come back every month and have a standing item on the board item where maybe the consultants don't come every month, but where we can give the board an update and seek feedback. I would say during this process, at least every other month, in addition to retreats or other things, we'd come back to the board. And so if there were pillars being suggested or seeking information on pillars, we would want feedback from the full board before we got halfway through it. So I wouldn't
How
want
did
to
we
wait.
do the equity plan?
I wasn't here for all of the equity plan. Maybe were you here, Ram? Or Cynthia maybe was here? Did you bring, one of my questions, did you bring drafts?
Yes.
So you brought written drafts of the strategic plan to the board to comment on?
And presentation, so it was
Okay.
primarily through, it wasn't a 300-page document
Well,
for the
yeah.
board to comment on, but we would bring our consultants, we would bring members of the community to the board meeting together input.
Okay, go
Dr.
ahead.
Brunson may have more information, she was more involved in that process, but I believe the difference, what happened, is we never had a policy before us that we needed to vote on. It was an iterative process, we had more engagement, it was over the course of multiple months, if you recall, Manager Jones. It was not something that here you are, sign off, and like, for instance, when I'm reading this policy, I do not feel comfortable signing off at this point because we have not had the level of engagement as we've had in the past. So that is really how it was. Yes, it's a lengthy process. It's not something that could happen overnight, over a meeting or two. It had multiple engagements, multiple inputs from both board members, staff, community, and all. And another thing that I echo Manager Jones, it's really sometimes I feel community is always an afterthought. We're more and I don't want that to be the direction as we're heading. And it may not be implicit, but it's really not clearly stated or defined as a priority. And when I look at it, it's like people associate public health and social services. It's not that. It's really building a health learning system. It's more involved in the data that really drives the decision making that we have put before us. So that is really something that I want to bring to everyone's attention. It shouldn't be like, for instance, we're not always here as a board member. We're all here, we're rotating, we're visitors, that's how I want to call it. But it shouldn't be if their board member was present to bring it to the attention of Central Health. It should be one of the the fundamentals of Central Health. The community is first and foremost. So that's what I have to share. Thank you.
Okay.
Thank you. And if you remember, and I'm sure Manager Jones, you and Dr. Brinson remember this, that the first phase of the healthcare equity plan development was the voice of the community assessment that we conducted. So we will start any strategic planning process and community health needs assessment with the voice of the community, and gathering that community input out of the gate is always where we start. And I apologize for not putting that on paper today. Thank you so much for lifting that up.
Did that answer your question, Elisa?
Well, I'm not quite sure yet that I understand what that whole process part of it, but that's okay, because I think over time it'll become clear to me in terms of the direction of where the board is. One final thought is I've done, as many of us, probably all of us in this room, been involved in strategic planning. I've done it both from the staff level, where we ourselves as staff did it and then presented it to the board, and then the board tweaked it and did what they wanted to do. Then I've also been at the level where that's when I was with Integral Care on their board, and we were doing believe it or not, a 10-year strategic plan. That's what was being called for from the ledge. But that being said, where we literally came in about 2 or 3 different times on a weekend, and we walked through the different, we didn't call them pillars back then, but we walked through the different goals and objectives within the context of the organization. From my perspective, I just want to know what can we expect, or what's the plan, so that I can chime in and be prepared to chime in at that appropriate juncture whenever we're going to do, however we're going to do it. That's where I'm at.
For transparency, Manager May, this next phase of the plan will likely include acute care, tertiary, maybe quaternary, mental health. So we're going to be bringing in the full range of complexity of the healthcare system. So I think it'll need to be a balance between subject matter expertise, including somebody might bring it from the outside who has that depth of knowledge, but always ensuring that what must be accomplished for the community at what cost for the taxpayers and within which boundaries, that is fundamentally the fiduciary duty of the board. But the board may not be the same level of health system expertise that we will have to have at the table to inform the specifics of the plan, if that makes sense. So we'll have to balance that given the scope and complexity of the plan ahead of us.
I'm not understanding what you're saying with regard to maybe I missed something. Are you talking about the process for the strategic plan, or are you talking about something else?
I'm talking about the process by which we get guidance, clear guidance direction from the board, and then we iterate to that next target. That iteration, I anticipate being informed by a great deal of subject matter expertise, but bringing back each time to check, did we get it right? Did we meet the board's directive? And if not, let's iterate further. But I'm not sure if I'm, the notion of us coming in together for 3 long days and writing the plan, I think may not be what I would envision given the scope of what we are trying to build here, if that makes sense. I'm just trying to answer the question that you're asking. Yeah. So more the first version of what you described than the second one, perhaps, if I'm hearing you correctly.
Yeah, I would see it not as writing the plan, because absolutely agree. But the plan has to be voted on by the board, which means we have to read it. And read the language of it, not the Cliff Note version of it, and not a shorter version of it, okay? Because that doesn't mean we write it. It just means that we have to approve it in an iterative process where we're seeing pieces of it, we're giving feedback, we're seeing the language for pieces of it over the time period is necessary for us to know what we're approving.
I think we're saying the same thing.
And that's not,
Yes.
okay, so we're saying,
Yeah.
did you want to, go ahead.
I have a comment in terms of, I think it will be helpful, because I am a little confused, bear with me, because there's multiple plans, multiple initiatives, multiple things that I am, as a board member myself, I'm like, what are we doing? And also it feels like every couple years we're coming with a new assessment, with a new strategy, and the health equity plan was something that we invested over $1 million of tax dollar money just for that plan. Well, I know there was, but I know there was a grant, all of it, well, regardless, but it was even like the time that it was really, that took to make that plan into fruition. So I think, in my opinion, we need to assess where we're at right now, and where do we need to go. Yes, we've had these retreats, but these retreats also felt more structured and we never had the opportunity as board members to give in our non-structured opinion about the direction of this organization. And that is just, again, that is my input, how I feel, but I am somewhat confused at times that multiple plans are coming before us. We are asked to vote on certain policies, which this is the first time that I read this policy, for instance. So we need more time to absorb, but also not undermining the expertise that we have on the table. Yes, we need subject matter to perhaps, if there is an area to educate us, and we'll make that decision as a full board. And that is what I'm trying to assess and understand where we're headed. But I would prefer some clarity as a board member. If I am a board member it's not clear to me, how can I communicate that to the public in a way that everyone can understand where we're headed and where we're going. So that is really my concerns and how I feel. I don't know if others have similar feelings.
Maybe I could back up for a minute, or no, you go ahead.
I was just gonna say, for example, one thing that I think, one thing and that I think is incumbent upon us as a board is to determine what the pillars are. While we talk about, patient care, access to patient care, that's probably in the pillars, but specifically, what are our pillars? What's gonna be the arching foundation? That's what that ends up being. And then from there, everything flows, right, depending on whatever they are and the timeline and so forth. But so that, to me, just the discussion on pillars, I think, is something, and you all may be calling it something else. I know the latest terminology is pillars. The last organization I left, that's what we talked about was pillars. So I'm using pillars. But that being said, that's a discussion that I think needs to flow from this board. And then how you fit in all the blanks and all the detail, that's where you guys come in. And maybe we're on the same page, but I'm not hearing that. I'm not clear, but it's okay, I'll figure it out.
Yeah, and did you want to say something before I make a comment, or?
All I'd like to say is I think the place maybe that we're having a little disconnect is historically at Central Health, it has been more involved than I think maybe what you've experienced, where the strategic planning committee and the full board and budget and finance at different times are involved in setting that direction. And it is, we have set up this deep feedback loop with lots of meetings. So it's not really anticipating 3 weekends of meetings or just just retreats to do this. It's an ongoing process over the course of the year that we get your feedback on before we even fully start it, to lay out exactly how the board is going to participate and when, and what, do we want to do the voice of the community first, or do we want to do pillars first? And that's the type of stuff that we would gather your input on before even really starting the work.
So just a couple of questions, or anybody else before I,
Manager Jones.
go ahead.
Well, I think that, I think we're in somewhat saying somewhat of the same thing, but the approach is different. I believe that it's important that the board set the guidance and the direction of where we want to go. Now, in doing that, we need to be as clear as specific as we can. Having done that, we need to step back and allow staff then to take what we've put together and come back with, is this what you're talking about? And then if it is, then we may proceed. If it is not, then go back and make these tweaks and other things. So I just want to make sure that we don't, one of the things, and the other question I wanted to ask, did you all ask this question of the people in San Antonio, how they went through that process of?
No, we didn't ask that detail.
I think one of the things that we're growing pains is that these institutions have been around 20, 30, 40,
Yeah.
50 years, I think. We're only in our 20th year. So these are learning curves, but I think we're saying somewhat, we're headed the same way. We just need to sit down and make sure that we are clear on what we're saying, all of us and not some of us. And one last thing, and I think Manager Masista said it, I've been on the board 8 years, and I have seen at least 5 or 6 different board members. When the board members come in with different ideas, strategies, then the question comes in, how does that fit in with what we as a board that put these forth together? So we need to have retreats or updates with the staff, so well, first with the board and then with the staff as to where they stand, because things change quickly. And in this environment, we're seeing that. So I just wanted to put that in so that you'll be aware. I think that's the way we should consider approaching it.
One thought or question, but let me see. Dr. Brinson, do you want to add anything? Okay. So one thought or question, because there's several different ideas we're talking about here. So let me talk about all the various different plans that we have. So here's a question for you, Monica. Is the thinking, or is your thinking, or maybe staff's thinking, Dr. Lee, that we can take the health equity plan? I have thought of the health equity plan as our North Star, okay, because it was a strategic plan, went through a huge planning process. Are we now talking about taking that plan and updating it? If we are, then I think that what Manager Musaitov said about we need to understand where we're at with that health equity plan, because that's going to inform the update. And so that would be one piece of what we would do, which was understanding where we were at in terms of what we've accomplished under that. So, but is that how you're thinking of it, Monica, as a strategic plan? Let me ask, just 1 second, let me finish this and then we'll. Is that what you're thinking, Monica, as an update to the strategic plan?
Is it okay if I answer the question, Chair Kitchen?
Well, my question's for her, but
Okay.
is that what you, as our strategic planning officer, is that what you would think?
I think it's a yes and, sorry about that. I would say I think it's a yes, and I think we need to, as we have, and we can bring back to you, I think every year in March or April, we brought an update that revisited what did we say we would do by now in the healthcare equity plan, which really is our current strategic plan. And where are we? What have we done? And I think continuing to track the progress we're making as we're in the middle of year 3 of this service delivery strategic plan, I think is important. I think part of what was laid out in this draft system transformation policy, which system transformation
whatever
guidance,
we call it.
yeah, whatever we call it,
Yeah.
is seeking direction from the board since, and I think a number of the managers have noted this, in the 3 years since the board adopted the service delivery strategic plan, Central Health has grown, we've grown in our connection with community care, the landscape has changed. What would be required to build a sustainable, comprehensive system that's going to provide this whole person care is we're at a different, we have different capacity as an organization. So I don't know if it's predetermined yet, whether building on the healthcare equity plan, and I think Manager Rodriguez, you said this. I don't know if we would get to the point after this year's planning process of where we would have one go forward updated strategic plan that might
Okay.
carry us out 5 years. So whether it almost is a matter of semantics to say, is it just a refresh of the healthcare
Or is it
equity
an
plan, or
overlay
is it
on it, or
kind of,
maybe?
is it an overlay, or is it something that becomes almost like a new thing in itself?
Okay, so we don't
Depending
know
on
yet.
the voice of the community, the CHA, and the updated
Okay.
gap analysis.
So so it may be something we have to get into before we know if it's an overlay or an update or whatever. Go ahead.
Yeah, at the highest level, we did a community health needs assessment 2022, which kicked off the plan. And again, the headline of that was that there were gaps in every area: primary care, specialty care, dental, mental health, acute care, and post-acute care. And we formulated a plan to largely close the gaps in specialty care and some aspects of respite, homeless care, transitions to care, dental care. We knew there was a huge gap in acute care and post-acute care, but we did not include that in the first round of the healthcare equity plan. I wasn't here at the time, but my understanding is it was always known, hey, that this is not the full circle. It's a really big piece. It's $800 million over 7 years. That's an important place to start. This is rounding out the circle. So this is not a new problem. It's simply updating in 2026 what we saw in 2022. So that's one concept. The second I'll lift up is the notion we intentionally named this a transformation, whether we call it positive policy or direction, and we intentionally proposed for consideration a 5-year window. 5 years from now, I think the landscape in healthcare will look different than it does today in Greater Austin. What role does the board wish for Central Health to play in that landscape? We could take the next 3 years to update our plan. I'm just being a little bit, as an edge case, and miss the window. Part of the intent here is to discern the will of the board in terms of direction. Where do we want to be? If in 10 years we want to deliver a 5-to-1 return on investment for taxpayers, and we want to reduce health disparities by half, what do we have to do in the next 5 years to create a system without edges that will really allow us to make that kind of progress in 10 years? It's that level of direction that we're seeking from the board. That may mean that we are transforming while we are planning at the same time, as we actually have been over the last couple years. I'll also add that when you look at the 7-year healthcare equity plan, it had phases to it. There was a clear phase of building, then there was a phase of stabilizing, and there was a phase of sustaining. And we projected out the investments through all those. We've actually largely come through most of the building phase, and successfully. 30 new clinical service lines, several new physical care site lines, our major new headquarters coming online, and so forth. And we are now in the stabilizing phase, and then there will be the sustaining phase. So what we are talking about is potentially overlaying a building phase on top of the build that's been completed, rounding out the circle of the full problem we saw in 2022. And we're going to update in 2026 with Sendero and CC our intelligence and data around that. But it's the same problem of filling in the gaps, the comprehensive gaps in the safety net care system that we saw in 2022.
Okay, did you want to say something?
Yeah, kind of following what Dr. Lee said and what Manager Jones said, I've been on the board for a while now, and we went through this whole health equity plan. I see this as a continuum of that. And it's because the board does change all the time, and we settled on this plan that we sat through endless meetings over, and the board will change. We have this vision and a policy to sort of, this is the next, on that break chart that you used to bring every time. To me, this is a simply permission to have the continuum to continue, what that was laid down in 2022 that it started, so that's all.
Okay, that's helpful. Go ahead.
Well, I agree, and that's what I assumed, that it's a continuum, but what I'm gathering and I'm sensing that it's something different. That's how I'm feeling. Some of those, like Dr. Lee mentioned, as the healthcare landscape is changing, evolving, the plan will evolve. So that's what I'm sensing. I just want to understand, clarity, like, is this a continuum of what we have vetted for over a year or so? Or is this something, yes, given the landscape is changing, things are going to evolve and change every year, and we don't know where we're headed, especially for our safety net population. So every time there's a dramatic, a change, do we need to change our plans? I know we need to adapt to some of the changes, absolutely, but also the fundamentals. So that's really the issue that I'm trying to understand. So I would really appreciate, in talking about the plan, that we have the health equity plan, providing us an update where we're at. I think it's critical to move forward. It is also critical for us to understand some of the barriers and facilitators within the plan that you assumed at that time was a great idea, and then after implementing it, you had some challenges or barriers, whatever it is. I think it will be helpful as we're moving forward to understand where we're at and how we're gonna move forward. So those are some of the pieces that I think are critical as we're heading forward. And in terms of level of engagement, I think to this level, the board should be engaged into the process. Yes, they're not gonna be engaged in the writing, but they're setting the framework moving forward, the pillars, how you per se. So that is really what I would recommend and suggest. Thank you.
Okay, I'd like to bring up a couple of other aspects for discussion, if that's okay with everybody. Because we're doing a combination of drilling down and also looking bigger. So, so let me say a few things first, and then there's a couple of different things to talk about. I want to make one point is that, yes, I agree with something you said earlier, Dr. Martin, about this concept of moving forward with, this transformation. We've been talking about transformational direction for a while. But I do want to note that we actually haven't asked the community about that yet. Or at least not that they'll say no or anything, but and they don't actually say no, but I don't think we have community input on transformation when we talk about the perspective. We certainly don't have community input yet on the various components that could include. Okay, we're having internal conversations, but we haven't gotten to the point where we've gone out in any robust way to ask the community that. So I just want to make that point. So that's just one thing to hold with, and I think that our strategic plan, once we get it, I'll call it our strategic plan, understanding that it may be an overlay, it may be a continuum, it may be an update, whatever form it takes, needs to have that community input. So there's that. And we haven't touched that point yet. So I just wanted to make that point. The other thing I want to point is a little bit different, so let me shift for a minute. We're talking 5 years, and Dr. Lee, you mentioned why you were thinking 5 years. So I want to just touch on that a minute, because we had there was some conversation at the last meeting about what should it be, 2 years, 3 years, 4 years, 5 years, 10 years. So can we just get some feedback right now on what are people feeling that 5 years is the appropriate time frame to have this conversation over, or is there any other thoughts that people have? Go ahead, Maram.
So, Monica, could you remind us how many years have we been through with the health equity plan?
So we're in year 3 of the healthcare equity plan. We had started actually in year 0, so this is year 3, because we actually started as we were completing the plan. We had started implementing a number of the projects that had burbled up in the plan, that the board thought, this is something that can't wait, you have to start moving on right now. So we're in the 4th year of implementation, the 3rd formal year of the plan.
So maybe, Chair, a 3 to 4 year will probably be relevant based on the health equity plan. Could be a time for an evaluation, an assessment of the plan if we need to update it or modify it, giving the circumstances as and maybe there are other nuances that emerge. So maybe making it lesser than 5 years, giving what that we just heard.
Okay. Thoughts?
Well, first a question, then a comment. So, Madam Chair, when you mean community, who are you talking about? Like when you say feedback from the community, what is the community?
You know, that's a good question, because that's a term that's difficult to define. But what I mean is the various types of processes that we've gone through in the past to get community input. So that might mean,
Community assessment, but that's to see if we need to change some management issues.
right,
But once again, to me, this is a macro view which is what we need, they need from us. And it says in the thing, to do a community assessment, health needs assessment, which is how it started, the whole thing in 2022, was assessment. These are our problems, let's assess it. So I think to a review every 3 years to say, what is the needs assessment, has it changed? But I would to reiterate that, it has been done. They're asking it to be done again, I think on a regular basis is a good idea because the community is changing. But I hope that we can stick to sort of a macro view of kind of, I think, what I'm hearing staff want from us to direct that. Because we can just get endlessly in a circle about we can't move because this has changed. We're saying things will change. The ACA and Medicaid and everything, but we have this macro view because, as Manager Jones said, the board's always changing and coming different ideas, but we all settled on sort of this is kind of we want the boat to go.
Yeah, now, let me clarify. I'm not talking about a community needs assessment. That's a different thing than community input. And I'm talking about community input that I can't talk about in specifics in open session. But the kinds of directions something you said earlier, at a high level, let's just say, if we think that one of the directions we might want to go in is community hospitals, okay? We have no input from the community on whether that's a direction to go in. And community input's always you just do the best, you do various things with it, but it's a matter of going out to the community and saying, this is what we think the direction we want to go. And I'm just pointing out that we haven't done that yet.
I think that's a good distinction. I appreciate that.
Yeah.
But I think I kind of see them as integrated into the same thing.
Yeah.
We see an assessment of things. Oh, I'm sorry. I think it's a very good point that you
Yeah.
made. I see it wrapped into the same thing. That if we see this would really benefit us in one way. Let's go see how the community feels about it. I think it's very important. But once again, I think the overarching things, yes, what do they need? But we're trying to drive this bigger boat. So we have this idea to say a community hospital. We go to the community and say, what do you think about it?
That's right.
But so I think we're kind of saying the same thing. I kind of see them as wrapped in together, that's all.
Yeah, and I wouldn't disagree with that at all. So it's a component, yes.
And if we might, we've got Ivan Davila, who is your Vice President of
Marketing Communications.
Marketing and Communications, who could just go through very briefly the key elements from the Voice of the Community assessment from the service delivery strategic planning exercise that we did a couple of years ago.
Thank you, Monica, and thank you, Board. Yes, several years ago, we did some community listening sessions, and we actually called them community dinners, so that they would be culturally appropriate for the communities that we serve. And we did them all throughout the community, specifically in areas with the highest concentration of people with low income. And we did them in both Spanish and English. We had facilitation, we had a meal, and children activities and transportation. So it was a very equitable process in terms of the community meals program. We also did we had several different publics that we were speaking to. So one was the patient group, and that's what I just spoke to. The other one was community groups, community partners, community advocates, neighborhood associations, and whatnot. And so if you recall, this was during the time when we were all, we were slowly getting into in-person. And so some of those listening sessions took place online with the community advocacy groups, others in person. So we brought the list of the groups that we were speaking to the board. We asked a board to help us ensure that we had everybody in mind. And so that was the community advocacy and community partner groups. And then we also had more of the healthcare organization. So those were the three publics that we were really capturing in the voice of the community effort.
And then I think you guys did some surveying.
Oh,
and,
absolutely.
yeah.
So those were only the in-person. Then we also did surveys, which were both online as well as intercept in the clinics. So it was a very, very robust process, and yeah.
Thank you.
Yeah. Is that it? Sure.
Thank you very much. Yes, did you want to say something?
A couple of things. One is I sort of agree with what Yvonne just said in terms of the level of detail in terms of community. But I think we need to have a more strategic plan in terms of geographic. We provide services to Travis County. Within Travis County, each community is changing differently. But those communities are within certain zip codes or certain precincts, or even within the city of Austin. So I think that as we go out to look at this next time, we need to map out where it is we want to get, because what I have seen is the changing demographics. And I'll just use this as an example. You were on council, I think, when I was the director. In order to get accreditation for public health, we had to go down to those levels and look at that detail. We had to go and do the things that Yvonne talked about. We had to demonstrate that. I'm just suggesting we need to have an ongoing strategy to do that level of detail on an ongoing basis, so that we don't have to come back and sort of question, well, what should we be doing? Because we already have it mapped out.
Okay. Okay. Okay, so I'm looking at the time. Are there other comments or conversation people want to have on this item? Looking around the room? No?
I guess there's just, we've heard a lot of very helpful feedback on process. Curious if there's any feedback on content of the proposed direction. And then I'm curious what the board would like us to do next with this work.
Well, I have a suggestion, but first let me look to the folks around the room if they have any thoughts. Do y'all have any?
So I would ask some time for us to read it through. I think to me, I think it'd be fair to give us to the next meeting or so. There's a couple board members also not present, and I think this is setting the tone moving forward. So I would ask for additional time, because I just mentioned, as I mentioned, this is the first time that I see this and read it. So that's why, again, I don't know what others are feeling.
Okay. Other thoughts?
Elisa?
Elisa? Nope. One of you?
I just sort of outline some parameters in terms of what you want to start to look at. Geography, and political jurisdiction, all that. So we have a picture of what the county looks like. Having done that, then I think it would be important for us as a team to come back and see what you found out from that. And then from that, we can make recommendation. We did so. We didn't put that health center out in Del Valley or in Hornsby Bend simply because we woke up one day and said, oh, we need one out there. We did that because of the work that identified what is needed there. And so I think we need to do some of that type of assessment in order to be able to go forth in terms of giving you what you just asked for, I think, in terms of what content needs to be in that. But I'm biased because I believe in geography and epidemiology, so I'd like to see the data. And one last thing, I won't be here. So with that said, you're gonna have a new, back to what I said a while ago,
Yeah,
you're gonna have a
yeah.
changeover in membership, and they may want to do something else. But I'm just saying, those are kinds of things I think will be critical.
Okay, let's see, Elisa, did you want to say something?
Just one last thing. If we're gonna call it a strategic plan, let's call it a strategic plan and not call it something else.
Okay.
Because one of the things that I struggled with in the beginning of this dialogue with you, Monica, was you were sort of thinking healthcare equity plan to some extent in terms of its evolution and development. And I'm thinking strategic plan like in the traditional form of a strategic plan, at least from my point of reference of how I've worked it. So I just wanted to keep it straight so that I'm straight and I can be of a better help partner to you than to be questioning things that perhaps don't make any sense. So that's just what I want to say.
Okay.
Thank you.
Other thoughts, comments? Did you want to, yeah?
I think, I'll speak for myself, but I also have, I also think that the reason, Dr. Lee, that you may not be hearing a lot about the content, because I think it's pretty solid around kind of what we all want to agree on what direction in this particular part. But I think giving people the time to make sure they digest it, because this is really, if this is going to be the will of the board, whether it's called guidance, resolution, policy,
whatever.
this is our this is our buy-in around the transformational changes that are needed. And you asked earlier about whether this is 5 years or other years.
Yeah.
I mean, honest, if it was just me, I'd be like 1 year or 3 years, but that's ridiculous because you're not gonna be able to implement it.
Yeah.
But that's the sense of urgent patience that we need to drive, because this transformational change will ultimately deliver the quality care for the poor and the vulnerable that we all want, and that we all want to measure the quality of. And so I think to me this gives you, Dr. Lee, the sense of the board, the guidance of the board, and we'll have conversations back and forth about the tensions and the barriers and the things you need us to support, and the things that you need from us and we need from you around all this. But I think this and the additional input from managers about what we need to edit is good to place a flag about kind of where we're headed in the, I think as manager Musayef said, was like the development of strategy at Central Health, and insert everything, health equity, whatever, all the other names, and we're moving towards one direction together solidly as a board, where we're just removing barriers and supporting the system that we all know that we need.
Okay. So here's the comments that I would make, unless there's, okay. I'm hearing a couple of things. I'm hearing that maybe in general, and y'all stop me if I'm not hearing the right thing, that maybe in general this is the direction, but I'm also hearing a request for more time in terms of voting on specific language. We also had quite a bit of conversation about the community input and aspect of this. Hearing that maybe 5 years is fine, some people think less, whatever. So my comment would be, I would need more time on this language, because for two reasons. First off, I think that I still don't think this is a policy that lives forever. I think this is direction that would go into how you do the strategic plan, because I think the strategic plan is iterative. And I also think that there's some language in here that needs some clarity and understanding on what it means, particularly where we talk about the board's roles. Because I would not want this language to be interpreted as limiting. So for example, it says that the board will actively direct the system transformation by exercising its governing responsibilities in 3 domains. I wouldn't want that read to mean, oh, you said only these 3 domains and you couldn't exercise your governance authority in other domains. it doesn't, the domains are, yeah, strategic direction, fiscal authorization, and performance oversight. That's good. But what about policies? Establishing policies. That's not written in here. So anyway, that's only one example. If at the point, and I do think the board needs to vote, at whatever point the board is ready to vote, we're gonna have to make sure we're all on the same page on the particular language. Because we don't wanna leave with the board thinking they set direction, and then Dr. Lee, you or your team hearing something different than we met. So that later we have to have some tension about what was actually meant. So to do that, we need more time to read this, and we're gonna need more conversation about the specific language. With that said, for me anyway, it's not about the general direction. To me, it's about this, it is, it's, let's make sure we're all on the same page in the words that we're using. Yes,
So
go ahead.
one last comment. I think there's a lot to uncover here. So I
Yeah.
think if it could be broken down, it will be much easier, more digestible
Yeah,
for us to
maybe bullets or
understand.
something.
Yes, rather than like, for instance, I saw something here about the Brackenridge development.
Yeah.
That should be separate, its own. I think there's a lot in here to unfold, and that is what I would hope that we can break it down and fully understand it, and in respect to the language, our responsibility, and also the will of the board and the direction that we want to move forward.
Okay. All right, so I'm going to move us on to the next item, right? Are we ready? Okay. All right, the next item is item number 4. Receive a presentation from Medical Care and Central Health on the diversion. Oh, sorry. Moving on to item number 4, receive a presentation from Integral Care and Central Health on the Diversion Steering Committee. That's Dr. Lee, John Morgan, and Dr. Schulso will be presenting.
Great. So, managers, Dr. Schulso and John Morgan will be coming to the mic to answer any questions you may have and provide a brief written update. And the most important update we wanted to provide is just to make sure that all managers are aware of a conversation that has been ongoing. Chair Kitchen and Vice Chair Brinson are aware, but we wanted to make sure all managers were aware. As you know, for a number of years, Judge Brown and colleagues have had a vision, important vision for diversion deflection in our community. We have been engaged in an ongoing diversion steering committee planning process. Approximately 2 months ago, Judge Brown and Commissioner Howard approached Jeff Richardson and me to observe that there was a very important evolution in thinking that had occurred over the course of the Diversion Steering Committee meetings, and that was that diversion itself is a critical component of a mental health care continuum. And we talked about some of that at the court just yesterday, I believe. Was it just yesterday?
Yeah.
Time's flying. And so in this recognition, this is a place where the justice elements and the healthcare elements come together. And they really asked Integral Care and Central Health to take more of an active role in really defining and helping support the court in leading the mental health continuum aspect of the diversion work, and to be clear that it is a critical component of that. And so, we made sure to make sure we were clear on the request. We discussed internally as an executive team and with our board leadership. Integral Care did the same. And our teams came together just in the recognition that this was a vital mission-centered request. That basically we if this was the request from the court, we were going to say yes, but we had to make sure, given how much else is going on, that we could do that. So we did that. We met with, in a series of meetings with Judge Brown, Commissioner Howard, their staff, key long-range planning staff of the county, some meetings between the county and the city staff, and so on UT. So a lot of activity that is still very much in the planning phase. But we wanted to make the board aware that this was occurring. We were clear that any major strategic direction, policy, financial, and so on decisions must be made by this board. And so all that we are doing is really assisting the coordination and exploratory at this point. And so there's a lot more to come. We wanted to make sure that we had updated the board on that we are in process, in that way, and provide opportunity for the board to ask any questions. John Morgan and Dr. Shalsha have been at the center of this work, and so we're all here together to answer any questions you may have. So thank you.
Okay, so thank you. Dr. Brinson, I thought it was really important that everyone be aware that these conversations are happening, and then just give you all the opportunity to ask any questions you might have about them. So I'll start on this side this time. Manager May, do you have any questions about this? No. Okay. Manager Jones?
Questions related to what? I'm sorry.
To the project that we're speaking about, which is the engagement of Central Health with the county and with Integral Care on planning for the diversion center. Yeah.
I just have sort of philosophical question. And as we look at the diversion center and citizens who are going to be part of that, who will ultimately end up out in society, is there any effort to work with targeted communities where, based upon the data, indicates that diversion over time and transition back in are going to be coordinated and collaborated? If that makes sense, if you follow me what I'm saying there.
Good afternoon, managers.
Yeah.
Great question. I think one of the things we've learned is that when we build a healthcare environment in isolation and we don't consider the continuum, either folks who are more severe in their disease or folks who are ready to potentially step out into the community, we end up building bridges to nowhere. So we are having, those discussions, and part of the discussion, I think Pat spoke to it perfectly. I think historically it was a justice-involved discussion alone, and then a mental health discussion alone. And I think those two have been now brought together. Sitting at the table with us is UT. So it's UT, Integral Care, and Central Health, really now looking at the entire care continuum and then connecting to housing. So how does this interface with some of the PSH environments and some of the longitudinal environments that we're working very closely with partners? I think all of these are interrelated. And the only thing I'll add, and then I'll turn it over to John, is I think this is complex, and so it's going to be kind of a phased approach and probably a multi-local approach in order to solve kind of the, not diversion, but the deflection process. So how do we actually get folks, that have mental health diagnoses into the right environment before they end up in jail?
Sure, I'll just add to the complexity comment from Dr. Shalsha. So I think there are multiple problems that I think this planning effort is seeking to address, and it's going to require more than one solution as well. So it's both the kind of high acuity emergency detention, involuntary services, those most acute individuals, as well as the lower acuity individuals that just cycle through the system over and over again and don't really receive the help that they need. So it's a very complex problem, and it's going to require a lot of different approaches to have a comprehensive solution. One of those is certainly working with organizations and groups throughout the community to make sure that we're actually addressing the root problems.
Just to make sure that intervention in the preventive aspect is being built into it as well.
Yes, sir. And the general idea for the lower acuity end of this spectrum is to have people diverted to mental health treatment instead of getting charged and getting put in jail. And so it's a fairly complex arrangement between the sheriff's department, the judges, the prosecutor's office, the defenders, the healthcare providers, the mental health providers, to really change the way that we process those individuals when they're picked up, and identify early the opportunity to help divert those folks into treatment and therapeutic environments instead of justice environments. Yes, sir.
Is this targeted only to those populations that fall within our eligibility or just?
I don't think it is. So this is really a larger and has been a multi-year community planning effort really led by Travis County. And I think they started approaching this problem from a justice problem where there's a high percentage of individuals that are in incarceration today in Travis County that have a mental health diagnosis and don't receive the level of service that they should have. And the judge and Commissioner Howard have both been really leading the way with that advocacy and the planning effort along with the county staff. So it is a community-wide, all patients, all individuals approach, but there is a high level of overlap with our patient population. And so we're talking about mental health and justice intersection, but there's also a very strong correlation to individuals experiencing homelessness, to substance use. So it absolutely is inclusive of our population, but not only our target population.
My last question is APH part of that planning effort or a coordinated effort?
We haven't been directly engaged with APH, but I know the county has, and they are part of that conversation in addition to the sheriff's department.
Okay, thank you.
Yes, sir.
Can I just, this is somewhat tangential, but we've been working with APH and Dr. Walks as far as data.
APH. I thought you said APD. Excuse me. You said APH? APH.
As related to medical record sharing and data sharing, and so, the more we can create that continuity of care for the patient instead of them living in isolation, I think the more we'll succeed. And Desmar has been acutely involved and actually leading that drive.
Okay, Dr. Martin, do you have anything?
Yeah, help my concrete mind handle this. Let's say an actively psychotic patient is picked up on 6th Street assaulting people. They're taken to jail. What happens? Like, what's the process? They're actively psychotic, hearing voices.
So right now, I think a lot of different things happen, and it's not a coordinated approach. So that person could get picked up by APD, they could get picked up by EMS. There are multiple places that they could go. They could go to Del Seaton Emergency Department. They could go directly to a psychiatric facility. They could go to central booking. They could go to PES at Integral Care.
But I'm sorry, John.
Yes, sir,
I mean,
please.
so I'm talking about, since you're talking about justice system,
Yes.
they're assaulting someone, they're psychotic, they're going to go to jail, pretty much, right? And what happens from they're actively psychotic? What happens in the jail?
Today
and
or
the next
future
process?
state?
Huh?
Today or in a future state?
Well, today, and then we can discuss the hopeful future.
Most likely, they go to jail.
Okay.
I think that's the advantage to working with our law enforcement partners is as we build out central booking, there's the opportunity to bring mental health, experts into that environment rather than being booked in jail and then start this cycle where they're in jail, they don't have access to meds, they don't have access to care. So I think that is an active discussion as well.
Right, I know, and that's where we want to go to, but what's the current situation?
Mostly they go to jail.
And then what happens in jail? Do they get
and
antipsychotics evaluated by a physician?
They do, and Dr. Brinson actually may be able to speak, somewhat to this, but they do get to antipsychotics or get access to antipsychotics, but I think they get pretty deep into the process before they get that access. Mm-hmm. And I think what we're talking with our law enforcement partners about is really providing that access up front.
Okay, so they get a psychotic prescribed by Cynthia, and they go home. I mean, assuming they've been what happens?
Well, it depends on the level of crime. If there's a misdemeanor, I think the county is really trying to work with the healthcare you know, with healthcare providers to really get them to the right environment, and that's where the need of the build is. If they have a felony or they're accused of a felony, most likely they stay in jail. And
Would any of these patients go to our respite care? They would not qualify for that? I mean, they're actively psychotic and they,
no,
No.
and so these are great questions. I think that is one of the things we've learned as related to respite is that, you know, if it's 60 to 70% of the folks that are in our respite environment have an addiction disorder or a mental health diagnosis, and we just don't have access to the care that they need in that environment, because respite is really built as a low acuity environment for folks, you know, to help them take care of their daily needs. So we don't have that environment built.
so would release a schizophrenic to the streets? I mean, assuming,
This is good conversation. I just have a problem with time.
yeah, okay, well, I appreciate it.
No, we
No,
can
that's
come
fine.
back to
Okay.
it.
I know, and I appreciate that. Yeah,
Yeah.
that's fine. I just kind of, the process is extremely messed up.
Yeah, I think that's a good point. So managers, what I'm, that's a very good summary. What I'm gonna do right now is recess the committee, so that we can go to our Board of Managers meeting. We just have some time constraints in terms of people having to leave. And then if you guys can still be around, we can come back to this item as well as finish out SPC after this. Okay? All right, so I'm just gonna recess the SPC meeting. And now I'm going to open us into the Board of Managers meeting. Good afternoon. Today is December 10th, and it is 3:09. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. As a reminder, some of our board members may be also participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. Okay, so managers, we are going to proceed to item number 1, which is approve the minutes of the special call Board of Managers December 3rd meeting. Do I have a motion to approve the minutes? Motion from Manager Jones, second. Second from Manager Rodriguez, all in favor? Okay, so now we're going to go on to item number 2. So, wait, that was C1 consent. I'm sorry. I did that wrong, but whatever. Now we're going to go on to item number 1. I announce that the board is convening in closed session to discuss agenda item number 1. Let me read that first. Agenda item number 1, receive, discuss, and take appropriate action on the fiscal year 2025 performance evaluation of the Central Health President and CEO. I announce that the board is convening in closed session to discuss agenda item number 1 under Texas Government Code Section 551.074 Personnel Matters and Texas Government Code Section 551.071 Consultation with Attorney. So the time is, today's December 10th, the time is 3:11, and we're going into closed session. It is December 10th, and the time is 5:36, and we're entering into open session. We are on item number 1. And do I need to read the item again? No? Okay. So, managers, I'm going to make a motion and then see if someone can make the second motion. The first motion is that I move that the board adopt the CEO performance review for fiscal year 2025 dated December 10th, 2025. May I have a second? Second. Dr. Brinson, all in favor? Okay, that passes. Now, the second motion that we need, someone want to make that? Yeah, 6%. Yeah.
I move that we, I move that we increase the CO salary 6% from the current base salary.
Okay, second? Second, Dr. Warner. All in favor? Okay. Okay, managers, we're now going on to our last item, which is confirm the next meeting date, I believe. The next meeting date of the Central Health Board of Managers is Wednesday, December 17th at 4 p.m. At this time, I'm ready to accept a motion for adjournment. Second? Second? Dr. Martin? Okay, all in favor? Okay, we are adjourned. Now, Steve, can we just leave it like that, or? Yeah, because we lost a quorum. Okay. Okay, managers, we are complete. Oh, I'm sorry.
Don't leave. No, we need your company. Good afternoon. Today is December 10th, 2025, and it is 5:45 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Ad Hoc Appointments Committee. As a reminder, one of our committee members may also be participating by video conference, so the staff will be managing video and audio feed of all participants closely to make sure we have a legally compliant meeting at all times. Do we have any public comment or not? No? Okay, good. We'll now move to the agenda. There, agenda item number 1, approve the minutes of the Ad Hoc Appointments Committee, September 8th, 2025 meeting. Do I have a motion? Okay, and I have a second?
I second it.
Thank you. All right, all approve? Aye.
Aye.
Nay, thank
Oh,
you.
I don't vote.
Right. You do,
I do
yeah.
for this?
Okay,
Okay.
all righty. Okay, agenda item number 2, review applications submitted for the Community Care Healthcare Center's Board of Directors and take appropriate action to select candidates to be interviewed on December 17th. I'll be presenting this item. I announce the committee is convening a closed session to discuss agenda item 2 under Texas Government Code 551.204 personal matters and Texas Government Code 551.20071 consultation with attorney. I'm gonna wait.
Recording in progress.
Okay. We're coming into open session. It is December 10th, 6:03 p.m., 2025. At this time, I move the committee select the candidates being interviewed by the committee on December 17th, discussed in closed session. Do I have a second? Thank you. All in favor? So moved. Okay, at this time, it's confirm the next regular ad hoc appointments committee meeting date and location. Our next appointments committee meeting is tentatively scheduled for Wednesday, December 17th, 2025 at 3 p.m. at Central Headquarters on Cesar Chavez, Austin, Texas 7872. At this time, I'm ready to accept a motion for adjournment. Cynthia, second, and thank you. So adjourned. Thank you. My goodness.